Substance use refers to the progressive use of alcohol. The most common negative effect of substance abuse is related to deterioration of general health. Generally, the negative effect of substance abuse can be categorized under social, physical, emotional, and inability to cope with daily routine due to psychological problem. A couple of factors cause substance abuse, including person's genes, the drug's action, peer pressure, emotional distress, anxiety, depression, and environmental stress can all be factors. Many who develop a substance use problem have depression, attention deficit disorder, post-traumatic stress disorder, or another mental problem. The substance of abuse being addressed in this presentation is alcohol. The history of alcohol abuse. In ancient time, the main components of alcohol include fermented grains, fruits, and juice. These components have been used for thousands of years to make alcohol. Alcohol use have a long history as fermented beverages existed in early Egyptian civilization. According to the drugfreeworld.org, alcohol was used in 7000 BC in China. Sure was among India's main alcoholic beverages used between 2000 BC and 3000 BC. In Greek, the first alcohol beverage to gain popularity was made from fermented honey and water. There is a lot of Greek literature warning against excessive drinking. The Greek literature on alcohol proves that substance abuse has long history. In 1630, the Puritans arrived in Boston in USA with a ship carry plenty of beer and gallons of wine. In 1920, alcohol use became intense to the extent that the US government passed laws prohibiting the manufacture, sale, importation, or exportation of intoxicating liquors. The government monitors alcohol abuse and has set up several correctional facilities to help addicts quit the dangerous drug. Prevalence and epidemiology in the US. Currently, more than 10% of adult in US population is addicted to drugs. The most common abused substance is alcohol. According to Mission Harbor Behavioral Health 2021, more than half the US adults report drinking alcohol in the past 30 years. Alcohol is responsible for approximately 29% of fatal traffic accidents in the country. Besides, excessive alcohol consumption is responsible for losing nearly 2.5 million years of potential life lost annually. Surprisingly, excessive alcohol use is the leading cause of death among American teenagers. The worldwide statistics by WHO prove that alcohol is responsible for over 3 million deaths per year. What are the risk factors of alcohol abuse? Excessive use of alcohol leads to addiction and condition called alcoholism. There is no particular cause of alcoholism, but rather a dozen risk factors are responsible for the development of alcoholism. These risk factors can be internal or external. The internal risk factors include genetic, psychological conditions, personality, personal choice, and drinking history. External factors include family, environment, religion, social and cultural norms, age, education, and job status. The population high vulnerable to alcohol abuse is younger adult, aged 18 to 24 years. Teenagers and young adults are curious to try new things, leading them to alcoholism. When alcohol use is embraced, there is a huge possibility of developing an alcohol use disorder. Binge drinking is glorified, and this is common among college students. What are the short-term and long-term side effects of alcohol abuse? Let's start with short-term effect. The short-term effect of alcohol abuse depend on the person's physical condition, how much one takes. These effects include slurred speech, drowsiness, diarrhea, vomiting, upset stomach, impaired judgment, unconsciousness, and decreased perceptions and coordination. Some people might experience headaches, vision and hearing problem, and breathing difficulties. The long-term effects of progressive alcohol consumptions are quite terminal or life-threatening. For example, a couple of deadly diseases are caused by excessive consumptions of alcohol, such as liver cirrhosis, mouth and throat cancer, ulcers, high blood pressure, stroke, and other cardiovascular health conditions. As well, alcoholics might get into unintentional injuries such as car crashes, falls, burns, and drowning. Besides, intentional injuries such as firearms injuries, sexual assault, domestic violence, increased on-the-job injuries, and loss of productivity, or are major long-term effect of progressive alcohol consumptions. What are the short-term and long-term side effects of alcohol abuse? Let's start with short-term effect. The short-term effect of alcohol abuse depend on the person's physical condition, how much one takes. These effects include slurred speech, drowsiness, diarrhea, vomiting, upset stomach, impaired judgment, unconsciousness, and decreased perceptions and coordination. Some people might experience headaches, vision and hearing problem, and breathing difficulties. The long-term effects of progressive alcohol consumptions are quite terminal or life-threatening. For example, a couple of deadly diseases are caused by excessive consumptions of alcohol, such as liver cirrhosis, mouth and throat cancer, ulcers, high blood pressure, stroke, and other cardiovascular health conditions. As well, alcoholics might get into unintentional injuries such as car crashes, falls, burns, and drowning. Besides, intentional injuries such as firearms injuries, sexual assault, domestic violence, increased on-the-job injuries, and loss of productivity, or are major long-term effect of progressive alcohol consumptions. What are the signs and the symptoms of alcohol abuse? Okay, so the common signs and symptoms include having strong craving to drink alcohol, spending much time drinking, overreacting to any perceived criticism raised against drinking, showing up intoxicated at work, healthcare facility, or family meeting, experiencing withdrawal symptoms such as nausea, shaking, sweating, especially when one does not drink. Lastly, some people develop alcohol tolerance. However, when assessing a patient with alcohol abuse disorder, it is worth noting his or her emotions since they are key in determining the level of addiction. Alcohol intoxication results as the amount of alcohol in the patient's bloodstream increases. The higher the blood alcohol concentration is, the more likely they are to have bad effects. Alcohol intoxication causes behavioral problems and mental changes. Someone can overdose on alcohol when someone drinks a lot of alcohol in short amount of time. Overdrinking alcohol results in alcohol poisoning, manifested by mental confusion, seizure, trouble breathing, extremely low body temperature, and slower heart rate. Alcohol poisoning can lead to death, and though alcohol can be used as a suicide weapon of choice, According to CDC 2015, there are approximately 2,200 alcohol poisoning deaths in the USA annually. How to care for someone who wants to quit alcohol use. Example, we have JK is 28 years old man who visited the clinic with major concern about alcohol abuse disorder. He mentioned that he has been drinking steadily and his family has a history of over drinking. After progressively questioning the patient on his related drinking habit, he was confirmed to have alcohol abuse disorder. So we can handle this situation first with pharmacology. We give medication to the patient. We can give him a camprosate, naltrexone, or disulfiram. For a camprosate and naltrexone, they reduce alcohol consumptions and increase abstinence rate. Also, the effect appears to be modest. For disulfiram has been used for years, but evidence supporting its effectiveness is inconsistent. Other medication like ondansetron may be beneficial to reduce heavy alcohol use. Also, we can do non-pharmacological approach to alcoholism. Psychological counseling is essential in helping the patient JK to understand the problem associated with alcohol abuse. Family therapy is also a key in helping people quit an addiction. So we talk about pharmacology and we talk about psychotherapy. Now we are talking about education, patient education. So patient education should initiate patients should initiate physical exercises like yoga to help in managing stress that possibly leads to heavy drinking. As well, JK should focus on medication, giving attention to things that matter, and eliminating thoughts that could initiate stress. Doing things that do not involve alcohol, including finding new hobbies, will help JK to recover from alcohol abuse disorder. Also, we can refer the patient to a facility or rehab facility to spend 1 week or two to help him and quit or in his withdrawal symptoms from alcohol. Also, we can do follow-up. The patient should visit the clinic every 1 year with a report on alcohol consumptions during the week for further clinical attention. In conclusion, alcohol abuse has a significant negative effect both social, economically, and in terms of health. For example, liver cirrhosis is common among heavy alcohol abusers. Teenagers and young adults are highly susceptible to developing alcohol addiction. In the US, alcohol is the most commonly abused substance and though account for high alcohol-related mortality rates. There is the certain pharmacological treatment for alcohol abuse disorder, such as camprosate, disulfiram, and naltrexone. Also, physical therapy and also psychological therapy. Alcohol Anonymous programs are really good, and staying away from alcohol users and seeking family psychological counseling help reduce intensity of alcohol use. Lastly, there is a need for further research to come up with more effective pharmacological treatment for alcohol abuse disorder.